Knee pain while walking isn't just due to old age. Have you ever experienced knee pain while walking? Stiff joints when standing up after sitting for a long time, aches and weakness in your knees when climbing stairs. And you think, it's probably just because I'm getting older. But the truth is, age doesn't cause pain. Cartilage wears the cause. Welcome to the Senior Health Channel. In this video, you will understand why walking causes knee pain, and 3 things to do today to protect your knee joints. Why does cartilage degeneration in the knee joint cause pain when walking? First, walking is when the knee joint has to bear the most load. When you walk on a flat surface, the force exerted on the knee joint is not just equal to your body weight, but much higher. During normal walking, the knee joint bears approximately 2 to 3 times the body weight. When climbing stairs, approximately 4 to 5 times. When descending stairs, it can be up to 6 to 7 times. This means that a person weighing 60 kilograms can put 120 to 420 kilograms of pressure on their knee joint with each step. Normally, the articular cartilage and synovial fluid absorb and disperse this force. But when the cartilage has degenerated, the entire compressive force is transmitted directly to the bone and soft tissue, causing pain. Second, articular cartilage has no nerves, but bone does. A very important point that many people don't know. Articular cartilage has no blood vessels, no nerves. The cartilage itself is painless. Subchondral bone, periosteum, joint capsule, ligaments are rich in sensory nerves. When the cartilage is intact, the 2 ends of the bones do not touch each other. Forces are cushioned, evenly distributed. As the cartilage wears away, the distance between the 2 ends of the bones narrows. The bone begins to bear direct force. Each step at this point is like 2 hard bone surfaces are pressed together without any protective cushioning, and that's when the pain becomes most apparent when walking. Third, increased friction, inflammation, pain, a vicious cycle. Cartilage degeneration is not just mechanical wear, but also triggers an inflammatory response. When walking on a degenerated joint, friction between joint surfaces increases. Tiny fragments of cartilage break and irritate the synovial membrane. The joint capsule secretes inflammatory substances. The joint becomes swelling, hotness, pain, stiffness. Therefore, the more you walk, the more inflammation increases. Rest helps, but movement again causes pain. This is why patients often say, at first, walking was normal, but after a while, the pain gradually increased. Fourth, joint fluid decreases and loses quality over time. Joint fluid is not just lubricant, it is the living ecosystem of the joint. Many people think joint fluid is just a type of oil. This is an incomplete understanding. Synovial fluid is a complex biological mixture, including hyaluronic acid. HA provides viscosity and elasticity. Lubricin reduces friction on the cartilage surface. Water plus electrolytes. Nutrients, glucose, oxygen, ions. Natural anti-inflammatory agents. Synthetic fluid is like the blood supply to the articular cartilage. Because cartilage has no blood vessels, therefore, all nutrients, all metabolic processes, depend on synovial fluid. How is synovial fluid produced and activated? Synthetic fluid is produced by the synovial membrane surrounding the joint. The special thing, synovial fluid doesn't flow continuously. It's pumped, drawn in, and redistributed each time the joint moves. When you bend and extend your knee, walk gently, move rhythmically, synovial fluid is pushed into the cartilage, nourishes the cartilage, then it's drawn back out. Therefore, correct movement helps nourish cartilage. Incorrect movement helps destroy cartilage. See what happens to synovial fluid when cartilage begins to degenerate. Cartilage degeneration triggers a chain of negative biological reactions. 1. Chronic mild inflammation of the synovial membrane. Synovial membrane cells reduce their ability to secrete high-quality. Instead, they secrete thicker fluid, less elastic fluid. The amount of fluid may not decrease immediately, but its quality has deteriorated. 2. Hyaluronic acid becomes shortened. Healthy hyaluronic acid has long chains, high viscosity, good force absorption capacity. When it degenerates, hyaluronic acid is shortened, loses elasticity, no longer forms a protective membrane on the cartilage surface. The joint has fluid, but not enough. 3. Lubricin decreases friction, increases many times. Lubricin is a substance that helps two cartilage surfaces slide smoothly against each other, reduces friction at low speeds, like walking. When lubricin decreases, friction increases sharply from the very first steps. Pain appears very early, even without walking much. D. Why do joints feel dry, squeaky, crackling when walking? This sensation has a very clear mechanism. Healthy joint, smooth cartilage surface, evenly covered with synovial fluid. Smooth, silent movement. Degenerative joint, cracked, rough cartilage surface, thin synovial fluid, poorly distributed. Both surfaces do not slide evenly, are rubbed at small points. Patients feel squeaking when starting to walk, crackling sound when bending and straightening, dull, gradually spreading pain. E. Why does the pain lessen after walking for a while, then worsen again? Many people say, it hurts after the first few steps, then it feels better after walking for a while, but it hurts a lot when I get home. The mechanism is, initially, joint fluid hasn't had time to distribute properly. High friction, significant pain. Continuing to walk slowly, joint fluid is activated. Temporarily better lubrication, pain decreases. Overuse, joint fluid becomes depleted of its function. Increased inflammation, continued cartilage damage. This is why overuse is very dangerous. G. Poor joint fluid, cartilage, starved of nutrients, accelerated degeneration. When joint fluid is of poor quality, cartilage does not receive enough glucose, oxygen, essential ions. Cartilage cells, reduced regeneration, easier cell death. This is a vicious cycle of degeneration. Poor fluid, weak cartilage, increased inflammation, even poorer fluid. H. Why is it that hyaluronic acid injections work, but not permanently? HA injections help increase synovial fluid viscosity, reduce friction, provide rapid pain relief. But it doesn't fix the source of inflammation. It doesn't completely restore cartilage. If you remain overweight, you still have incorrect movement, you still have persistent inflammation, HA will lose its effectiveness faster. 1. Signs you have lack of quality synovial fluid. Knee pain when starting to walk. Feeling of joint dryness. Crackling sound when bending and straightening. Pain increases with long walks. Relieves with rest, recurs with movement. It's not just a lack of synovial fluid. It's the synovial fluid that has lost its quality. The joint still has fluid, but it's no longer sufficient to protect the cartilage. Walking is just when the lack of lubrication is most evident. 5. Meniscus damage, uneven force distribution. Increased pain when walking. The two C-shaped meniscus cartilages have the following functions: distributing force evenly in the joint, maintaining stability during movement. When degenerative changes occur, the meniscus tears, thins, or deforms. Uneven force distribution on the joint surface. When walking, one area of the joint bears excessive force, causing localized pain, pain in one knee, pain on the inner side of the knee. This is why many people only experience pain in one knee, not the entire joint. 6. Muscles around the knee weaken. The joint bears the weight instead of the muscles. In a healthy knee joint, the quadriceps, hamstrings, and gluteal muscles share the load. When degenerative changes occur, pain, reduced movement, weak muscles. Weak muscles, the knee joint has to bear more force. Each step becomes. The knee joint works for the entire muscular system. This leads to walking becomes more painful, muscles become weaker, the disease progresses faster. 7th, bone spurs and joint deformities stimulate pain during movement. In moderate to severe stages, The body creates bone spurs to self-stabilize the joint. But these bone spurs rub against soft tissue, compress nerves, reduce range of motion. When walking, joint movement is not smooth. Sharp, deep pain appears in the joint. There is a feeling of stuck or locked in the knee. Eighth, why does it hurt when resting but hurt when walking? This is a question many people wonder about. When resting, pressure on the joint decreases. Inflammatory response subsides. Pain temporarily decreases. When starting to walk, the joint has not had time to lubricate. Friction is high. Pain appears immediately. That is why it is usually most painful in the morning after waking up, or when standing up after sitting for a long time. Pain while walking isn't due to excessive walking, but rather to the cartilage no longer adequately protecting the joint, the mechanical force exceeding the joint structure's capacity to withstand it, inflammation, friction, and instability occurring simultaneously. Walking is merely a test, revealing pre-existing damage. 2. 3 things you need to do today to protect your knee joint. Thing 1. Correctly assess your knee joint condition. If the diagnosis is wrong, all subsequent efforts are meaningless. First, why is knee pain not synonymous with osteoarthritis? Many people self-diagnose. Knee pain equals osteoarthritis. Severe pain equals serious illness. Reduced pain equals stable condition. This is a dangerous mistake. The same knee pain symptoms can be caused by cartilage degeneration, meniscus tear, halpitis, tendinitis of the patellar tendon, bone bursitis, inflammation of the synovial membrane, gout, rheumatoid arthritis, pain radiating from the lumbar spine. Each cause requires a completely different treatment strategy. Secondly, what does a proper assessment include? Clinical examination, don't skip it. The doctor will observe gait, misalignment, limping, palpate the knee joint, warmth, swelling, effusion, check range of motion, test ligaments and meniscus. This is a step many people skip, but is extremely important. X-ray, see the bone, helps detect joint space narrowing, bone spurs, joint deformities. Note, X-rays do not clearly show cartilage, so early stages may be missed. MRI, visualizing cartilage, tendons, and ligaments. Indicated when prolonged pain but X-rays are inconclusive. Suspected meniscal tear. Preparation for advanced intervention. MRI helps assess cartilage quality. Detect early damage. Decide whether or not surgery is necessary. Thirdly, when should you get checked? Immediately. Knee pain lasting more than 2 to 3 weeks without improvement. Pain increases with walking. Morning stiffness lasting more than 30 minutes. Swollen, warm knee, limited movement. History of knee injury. Don't wait until you can't walk to see a doctor. Step 2. The right intervention, at the right stage, at the right level. Not all harsh treatments are good, but appropriate treatments are. First, the most common mistake, enduring pain or overusing medication. Many people trying to walk despite severe pain, using painkillers for extended periods, receiving continuous joint injections without proper indication. Consequences: pain may temporarily subside, but cartilage continues to wear down faster. Increased risk of complications. Second, must-do interventions early. Weight loss, the most powerful medicine for knee joints. Losing 5 kilograms, reducing hundreds of kilograms of compressive force per day, reducing systemic inflammation, significantly improving pain. This is the most effective, cheapest, and most sustainable measure. Proper exercise, no complete rest. Complete rest, weak muscles, joints bear more weight. Proper exercise, strong muscles protects joints. Prioritize slow walking on a flat surface, cycling, swimming, exercises to strengthen thigh and glute muscles. Avoid high-intensity running, jumping, climbing stairs excessively, deep, squatting. Physical therapy, don't try to do it yourself. Physical therapy helps redistribute force on the joints, improve gait, provide lasting pain relief. This is a part many people overlook. but it determines whether the disease progresses or not. Third, medication and medical intervention. Only use when necessary. Pain relievers, anti-inflammatory drugs. Use only for short periods. 2. Not use continuously for many weeks. Joint injections, corticosteroids. Reduce inflammation quickly, but do not inject repeatedly. Hyaluronic acid, lubrication, friction reduction. Not everyone needs injections, only when indicated. Surgery, the last resort, only considered when severe pain, conservative treatment fails. Loss of mobility. Step 3. Prevention and maintenance, determining the future of the knee joint. Treatment helps reduce pain. Prevention determines how long you can walk. First, control factors that silently destroy cartilage. High blood sugar cartilage is more prone to inflammation and degeneration. Prolonged stress increased systemic inflammation. Lack of sleep reduced tissue repairability. The knee joint doesn't just depend on bone. 2. Lifestyle. 4. Protecting knee joints. BMI less than 23. Sleep 7 to 8 hours/night. Eat plenty of green vegetables and fatty fish. Drink enough water. Avoid alcohol and tobacco. 3. Care when osteoarthritis is present. Apply cold compresses when swollen. Rest after exercise. Use crutches or a walker when needed. Organize your home to avoid falls. Provide mental support. Reduce anxiety. A positive mindset significantly reduces pain sensation. 3 things to do today. Know exactly where your knee joint is located. Intervene correctly. Don't overdo it. Don't neglect it. Change your lifestyle to maintain knee joint health. Long-term, knee pain when walking is not a minor issue, and certainly not something you have to accept just because of age. It's a sign that the cartilage is no longer able to protect the joint. Inflammation, friction, and instability are occurring simultaneously. The good news is, if you identify it early, intervene correctly, and make timely changes, you can absolutely slow down degeneration, reduce pain, and maintain long-term independent mobility. Don't wait until pain controls your life. Protecting your knee joints means protecting your freedom of movement. Thank you for watching the Senior Health Channel. If you find this helpful, please subscribe to the channel to live healthy and walk confidently every day.